Worldwide, it's estimated that more than 100,000 people die from snakebite every year, and the majority of those deaths occur in developing countries. To address the problem, the WHO has, for the second time in the past 8 years, added snakebite to the highest priority list of neglected tropical diseases. Dr. David Williams is head of the Australian Venom Research Unit in the Department of Pharmacology and Therapeutics at the University of Melbourne. He's in Papua New Guinea, leading an Australian Venom Research Unit. It's where a new anti-venom for taipan bites has just finished clinical trials. This could save up to 1,000 lives every year. David Williams, welcome to RM Breakfast.
Hi, Fran. How are you today?
I'm great, thanks, David. David, can you tell us a little more about this new anti-venom you've developed with the team in PNG?
Okay, so this is a project that we've had going for just over 10 years. It's based on the need to reduce the cost of treating snake bites in Papua New Guinea. Fortunately, and there's a lot of factors, one of the main ones being the international exchange rate. The cost of the current antivenoms they use has been very expensive, anything up to $2,000 per dose. Now, as a result of that, the government can't afford to buy enough to treat everybody. And in fact, probably 15 to 18% is about the number of people that have got access to antivenom at the present time.
Because that's all that the government can afford.
That's all they can afford. So if you're in the other 82 to 85%, your prognosis is not very good.
Well, that's a lot of people, isn't it? Because the statistic I've seen is that 3,500 people in PNG get bitten every year.
Exactly. And of those 3,500 people, probably a little bit under 50% of them are actually bitten by venomous snakes.
Yep.
So, people get bitten by non-venomous snakes, or they might stand on a stick in the night and think they've been bitten by a snake. So there's a reasonable number of what we call dry bites or non-envenoming bites.
Yep.
But for the 1,500 people who are actually bitten by, a Papuan taipan or a death adder or a black snake, the prognosis really is very poor unless they can have access to antivenom within the first 3 to 4 hours.
Okay, so this is where you come in. It sounds like it's potentially going to save hundreds and hundreds and hundreds of lives every year. Tell us your new antivenom. What price would that come in at? Would that be more affordable?
Yes, so what we've done is we've focused on the species of snake that's responsible for the majority of the bites with taipan snake. So it's the same species of taipan that's found in North Queensland, but it bites over 1,000 people a year across the southern half of Papua New Guinea. So we developed a new antivenom for treating bites by this snake in collaboration with our partners here in Papua New Guinea and partners in Costa Rica. And we've put that antivenom through some fairly rigorous clinical trials, and it's proven to be at least as effective and as safe as the current product. So now we're in the process of getting it licensed so that it can actually be put to use. And if it is used, it will reduce the cost by around about 90%.
Okay, so it'll become very affordable. Is this, so that's potentially a game changer or a lifesaver, really, let's put it that way, in PNG. What about around the world? I mean, estimates of 5 million people being bitten by snakes every year. As I mentioned earlier, 100,000 dying from snake bite and 400,000 left maimed or crippled. Do we have enough antivenom in the world to address this scale of snake bite?
We don't have enough good quality antivenoms that are safe and effective. So this is one of the problems that we've got, particularly in regions like sub-Saharan Africa, where there is very limited local production, so they import antivenoms from other regions of the world, and those antivenoms don't necessarily meet the right standards. They may not cover the right species of snakes, or they may have been manufactured to lower standards, and as a result they may have higher adverse reaction rates, so they may potentially cause harm to patients, or they may simply not be potent enough and they just don't neutralise the venom of the snake, so the patient spends a lot of money on this particular product and doesn't actually get a good outcome.
Okay, so just briefly, David, now that it's been listed by the WHO on the priority list of neglected tropical disease, just briefly, what difference will that make?
Well, the really big difference is it's going to raise the profile of a disease that's largely been forgotten by the public health community. You know, the one good thing about snakebite is that if you can supply effective treatments, you can save the majority of people. So it's a treatable disease and there is a cure available.
Okay.
We just have to improve the quality of those medicines. We have to make sure that they're accessible and that they're affordable, and that, for example, health workers who use them know how to use them properly. Communities are made more aware of the fact that they're available and that they need to seek conventional medical treatment.
Okay.
And we could save most of these lives.
David, thank you very much for joining us.
No problem, it's a pleasure.
And thank you for the work of you and your team. Dr. David Williams, head of the Australian Venom Research Unit in the Department of Pharmacology and Therapeutics at the University of Melbourne, working on this project in PNG.